Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show.
Emerging and re-emerging diseases. All you have to remember is just triple S and CD. Steroid dependent or damaged faces, syphilis, scrub typhus. C and D are for chikungunya and dengue fever. This is the smallest question but most unexpected question for our finals, which when I am writing I got this question and I wrote many diseases names except this topical steroid dependent or damaged faces. After studying this topic only I got to know it is also a emerging disease. This phenomenon is described in 2008. Coming to its definition, semi-permanent or permanent damage to facial skin due to irrational, without any need using that cream, indiscriminate, unsupervised or prolonged use. If the doctor told to use for a short period of time only to a short area, small area, patient can use indiscriminately over the entire face, and he may use for a long period of time, that is prolonged use. All these will lead to semi-permanent or permanent damage to facial skin, which results in a plethora of cutaneous signs and symptoms. What do we mean by plethora here? Plethora means various huge number of things. Here multiple signs and symptoms will occur. That is hypo or hyperpigmentation, papules, pustules, perioral dermatitis, photosensitivity, acneiform eruptions, allergic contact dermatitis, dryness, telangiectasia, rosacea-like rash. Many signs and symptoms will occur. Because of this hypopigmentation, this cream is also sold as a fairness cream, manipulating people. Not only affecting the skin with plethora of signs and symptoms, patient will also develop psychological as well as physical dependence. Dependence means if he is using the cream, he will get all these complications. Instead of this, he will continue to use, because if he stops abruptly, he may get rebound phenomena. So he will continue to use. This is the dependence which we have studied in our psychiatry during our NEET preparation. Creating a vicious cycle of compulsive drug application. So you will think it is better to apply the cream and continue using it. Main reason for this is wrong potency, wrong indication and wrong age. We all know that for children and old age people it is better to avoid steroids. If we are giving, we have to give a mild potent steroid. If we give a high potent steroid at wrong age for wrong indication, like we have prescribed steroid for eczema but the patient started to try it for their acne, he is taking his self treatment. Otherwise, normal people also, when we go to medical shop, there will be steroid creams displayed like exhibition very clearly, that as a fairness cream which we will get attracted immediately, which will be available easily over the counter, very less price, less than 100 rupees I think. So poor people, uneducated, once they will get attracted and they will ask the price, as they are getting it for a lowest cost freely over the counter, so they will buy and use it to check whether it works or not. Initially it will work excellently, they will become very white and they will continue to use, thinking it as a fairness cream, ultimately becoming a victim for topical steroid dependent or damaged faces. So here sufferers are mostly poor people. If poor people are suffering, no one is going to care. No rules and regulations, no government is regulating anything, easily over the counter they will be getting the cream. Next, what to do, how to treat it? We know the culprit is steroid, just we have to stop the steroid. But if it is a high potent steroid, if we stop abruptly, rebound phenomena may come, so we have to taper the dosage or potency or usage slowly. We have to give just bland emollient and give time to skin to heal, to reduce the inflammation. If he is having acne, we have to treat acne. If the patient develops rosacea like rash, we have to treat rosacea according to signs and symptoms. Then coming to second, yes, that is syphilis. Its incidence has been tripled in last 10 years. That means already it has emerged, now it is re-emerging since last 10 years. Here in this topic, only topical steroid dependent phases is an emerging disease. Rest all are re-emerging. Again they are showing up, especially among men having sex with men and HIV positive patients, people living with HIV. Most common mode of transmission. What is the culprit causing syphilis? It is a spirochete treponema pallidum. Mainly it will be transferred via sexual route. If untreated, it passes through 4 distinct clinical stages. Distinct means different to each other. Now, irony here is, if once a patient gets syphilis, if he thinks, I am very strong, why to go to hospital, or it will resolve on its own, let us wait and see. It will resolve on its own, but internally the disease will progress to the next stage. First, within 9 to 90 days of sexual exposure or getting treponema pallidum via various other routes, patient will get primary syphilis. That is, he will experience an ulcer at the entry point of that spirochete. That ulcer will be very hard. That's why it is called hard chancre. It was first described by John Hunter, a surgeon who studied venereal diseases at that time. This ulcer will resolve on its own. So patient feels, I got rid of the disease, I am very strong, but in reality he is progressing to next stage, that is secondary syphilis. After weeks to months, he will develop a skin rash. But he won't think because of this ulcer and skin rash is related, he will neglect again. The skin rash can present like any other disease. So that's why we are calling it as a great imitator. It can mimic any other rash. Then it will also resolve on its own. So patient will feel he is very safe, but he is landing into next stage, that is latent syphilis. If it is within 2 years, we will call it as early latent syphilis. If we don't know the duration when he got exposed or when he got ulcer, or it is more than 2 years, then we will call it as late latent syphilis. This stage is clinically quiescent. That means patient won't have any ulcer, won't have any skin rash, he will be absolutely fine outside. When we do lab test, we will get to know he is suffering from syphilis. Then ultimately, last stage, tertiary syphilis. Here he may get again clinically gamma, or he may land into cardiovascular syphilis, neurosyphilis. Syphilis may affect any organ of the body. It can mimic any disease. What is the treatment for syphilis? We all know benzathine penicillin. According to the stage, we will give. Next, S is for scrub typhus. It is a acute febrile illness caused by gram-negative bacteria Orientia susugamushi, transmitted by chigger's bite. Here what do we mean by chigger? Chigger is a larval stage of mite. That mite name is very complicated, no need to know. Just larval stage of the mites are called chiggers. These chiggers will live in scrubs. What do we mean by a scrub? A scrub is an area where small grass, lands, bushes at the edge of the forest, it will be there. There chiggers will be living peacefully. When we go to their area, it will bite. After that chiggers bite, 10 to 12 days later, patient develops a papule which enlarges with central necrosis to form a flat black eschar. Why after 10 to 12 days only it is happening? Immediately after bite, we won't feel anything, no pain at all. It is a painless bite. So we will not see something bitten or not. Then after 10 days only we will get one eschar. What is the difference between an eschar and a crust? Crust we all must have experienced when driving a cycle or when we play, we must have fallen down and got superficial abrasions, and then that exudate will dry, leading to crust. Crust, we can easily remove that. While healing, it will form. But eschar is a necrosed black tissue. It will be thickly adherent to skin. If you try to remove, underneath that ulcer may be there. Because of necrosis, there may be ulcer also. So here we are getting eschar. Apart from that, what are the systemic features we can see in scrub typhus? Anyway, it is a acute febrile illness. So for mild strains, it will cause fever, cough, headache, myalgia, and mild GI symptoms. No internal organs are affecting here. If it is a mild strain of Orientia susu-gamushi. If it is a virulent strain, it will affect all the internal organs. Inflammation of internal organs, that is itis, myocarditis, interstitial pneumonitis, encephalitis. If brain tissue is inflamed, it is encephalitis. If meninges are inflamed, it is meningitis. Here we are getting encephalitis. Most number of cases of encephalitis are found in Bihar, the state which produces most number of IAS and IPS officers. It may also cause morbilliform rash, hemorrhage, lymphadenopathy, leukopenia, liver abnormalities, splenomegaly if it is a virulent strain. What is the treatment for scrub typhus? It is doxy, 100 mg BD for 7 days. What is the difference between a scrub and a dense forest? I have already told you, if we go to scrub that are small grasses or bushes, we will get chigger bite. That is painless bite. If we go to a dense forest where huge trees will be there, then we can get leech bite. That is, it is also a painless bite, but it won't cause any disease. Once I went to a trip, only trip I went is Yana Caves and Dudhsagar waterfalls. These are the examples for center of a dense forest. There I got bitten by a leech, but it is very painless. I don't even know it is biting me. It is a very good experience for me. Only trip I went. Whenever I think of that, I can still feel the fresh breeze and drizzling. There will be always raining there near Anna Caves. Anyway, I thought I won't come again, so I have seen this twice. I have roamed here inside these caves twice. In your PG life, whenever you get time, just go for a trip. Don't neglect. After PG, you won't even get time to enjoy. Thereafter, only responsibilities will be left for you. This is Dudhsagar waterfalls. The best experience I have got when I went there, where Chennai Express movie was shot here. When we go here, the train for Dudhsagar will be passing through many caves like this. It will be the best experience. Here it is not me. I have downloaded this picture from Google. There will be many caves like this, and when we walk on this track, always that drizzling and fresh breeze, we will feel relieved from stress immediately. My junior went to Netravati Peak. It is also very excellent to see. Once I have to try that also when I get time. So remember, when I am teaching you scrub typhus, I have taken you a tour to Dudhsagar waterfalls and Yana Caves. Whenever you get distracted while studying or any disturbance you get while studying, just think while studying which topic you got that disturbance. So it will help you for long-term memory of that particular topic. Every distraction or disturbance you have to use for yourself to remember the topic for a long time. Last two diseases, chikungunya virus and dengue virus. Both of them will be transferred via this vector Aedes aegypti mosquito. Chikungunya virus has got one more vector recently, that is Aedes albopictus mosquito. After this mosquito bite, we will get chikungunya virus. Within 4 to 8 days, we will experience an acute viral illness. Symptoms with high fever, disabling arthralgia, transient maculopapular rash. Then dengue virus. It is transmitted by Aedes aegypti mosquito bite. Within 4 to 14 days, we will get a severe flu-like illness. It will also cause maculopapular rash. There will be severe thrombocytopenia, which will lead to hemorrhage-like experience, hemorrhage-like thing. Blood will come out and cause petechiae, purpura. If you see BP for a dengue patient, that cuff will give some pressure. There also we can see petechiae. That is called positive tourniquet test. There will be severe fever, nausea, vomiting, arthralgia, severe back pain and headache. If we get dengue, that back pain and headache will be very severe. We can't tolerate. What is the treatment for both chikungunya virus or dengue virus? There is no specific antiviral therapy. So all we can do is symptomatic treatment. Hydration, paracetamol. Here, what is the reason for re-emergence of these diseases? Once they have showed their power, they have emerged. Now again, why these diseases are emerging? We will use our common sense and guess. This syphilis is re-emerging because of some magic moments without any safety. Then scrub typhus. If we are going to their area, it is going to bite us. So globalization, deforestation. Here, what is the reason for chikungunya virus and dengue virus? They are mosquito bite. So poor vector control, again globalization. And new vector is also emerged now, that is Aedes albopictus. So it is again re-emerging. Remember my channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. Desvidania.